Today we go on to diabetes mellitus medications part 3 sulphonylureas. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Sulphonylureas. They were introduced in the 1950s and used in the treatment of type 2 diabetes mellitus. They increase the release of insulin from pancreas. Along with diet and lifestyle modifications, they may control the blood sugar. They may require addition of other medicines, or patient is already on metformin, sulphonylureas may be added to metformin. Benefits: it reduces the complications of diabetes, such as heart disease, stroke, nerve damage, kidney damage, and eye problems. I've already put a video on complications of diabetes. Decreases the HbA1c. Molecules: there are different kind of molecules available. GLYBURIDE, which is also known as GLIBENCLAMIDE, GLIMIPERIDE, GLYPIZIDE, and GLICLAZIDE. I was just going into the biochemistry of these 4 different molecules, and these are available as combination medicines. So coming to GLYBURIDE, it's a long-acting sulphonylurea. Usually it is given as 2.5 mg to 5 mg tablets are available. Maximum dose is 20 mg per day. Elimination half-life is 10 hours. It's metabolized by the liver but excreted by the kidney and liver. So since it is excreted by the kidney, the dose has to be reduced or avoided in impaired kidney function. GLIPIZIDE. It comes in 2 forms, intermediate release and extended release. Usually 5 mg per day is given. Maximum dose is 40 mg per day for intermediate release and 20 mg per day for extended release. Intermediate release is to be taken 30 minutes before meals and extended release with a meal. Elimination half-life is for 2 to 5 hours. So if you take 1 tablet, 50% of the medicine is disintegrated in 2 to 5 hours. Metabolized by the liver and excreted by the kidney and feces. So dosage has to be reduced in kidney disease. GLIMIPERIDE. It's available as intermediate release tablet, 1 to 2 mg per day, maximum 8 mg. To be taken just prior to meal. Metabolized by liver and excreted by kidney and feces. So it is to be avoided in kidney disease. GLICLAZIDE. Intermediate release and modified release are available. Intermediate release to be taken 30 minutes before. 80 mg tablets are available. Maximum 320 mg can be taken. Modified release is to be taken once daily with meals. 30 and 60 mg tablets for modified release are available with maximum dose of 120 mg. Elimination half-life is approximately 10 hours and may be used in mild kidney disease. Does have side effects such as may develop low blood sugar. Because of low blood sugar, the patient may get hunger pangs. It may cause weight gain, may cause skin reactions, upset tummy, and dark colored urine. Precautions: avoid in kidney disease, liver disease, and if you're fasting, then you have reduced the dose. Avoid GLYBURIDE in elderly. If the patient is having a certain enzyme serum G6PD deficiency, then you can avoid. Do not combine with megalinides. And if you forget to take a tablet, take prior to your next meal, but do not double the dose next day, as you land up with low blood sugar. It interacts, it prolongs the effect of the sulphonylureas effect increased by acetyl salicylic acid, allopurinol, a drug used for gout, and various fibrates. Drugs reducing the efficacy are such as corticosteroids, isoniazid, oral contraceptive pills, and thyroid hormones. These drugs reduce the efficacy of sulphonylureas. Follow-up. So, regular monitoring of blood sugar is required. Monitoring of the kidney function will be required and may require the addition of more anti-diabetic medications if the blood sugar is not under control. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Subscribe to the channel and share link with your friends. Thank you once again.